My name is Dr. Brian Nickel. I'm an anesthesiologist practicing chronic pain management for the last 20 years in North Little Rock, Arkansas. Medical cannabis has been an interest of mine for a very long time. I have been using it in my patients for a period of time with some very good results. In addition to certifying you as a medical marijuana cannabis patient should you meet the criteria, I think it's important for my patients to have a basic understanding of medical cannabis and why I'm giving you the advice that I am. That's the purpose of this video presentation today. We will meet personally where we'll go over your personal recommendations for your use of medical cannabis so you can obtain the most beneficial results possible with the minimal amount of side effects. In the state of Arkansas, you must have a qualifying condition to qualify for a medical cannabis certification. Qualifying conditions in the state of Arkansas include cancer, glaucoma, HIV or AIDS, as far as having a positive test status for that, hepatitis C, amyotrophic lateral sclerosis, Tourette's syndrome, Crohn's disease, ulcerative colitis, post-traumatic stress disorder, severe arthritis, fibromyalgia, Alzheimer's disease, cachexia, also known as wasting syndrome, peripheral neuropathy, intractable pain, severe nausea, seizures, or severe and persistent muscle spasms. Other conditions which are not qualifying conditions that can be addressed with medical cannabis provided the patient has an additional qualifying condition. I often ask patients on the initial interview, have they used any cannabis previously? The vast majority of patients have, and almost all of them have found that cannabis does improve their symptoms somewhat. This has been borne out in some survey studies. They have shown that 9 out of 10 patients will get an improvement, some improvement, of their symptoms using cannabis. Now, it doesn't matter what type of cannabis they use. A gummy bear they get from a dispensary, perhaps they buy a joint off the street, or if your neighbor has a plant grown in the backyard, you steal it, roll it up, and smoke it. 9 out of 10 patients are going to get some improvement of their symptoms. That's a wonderful thing about cannabis, a virtue in how easily it works and treats so many different conditions. But, the first of many with cannabis, unfortunately, I see cannabis as being very much like those old Greek heroes we used to read about in high school. Its biggest virtue is its most tragic flaw. With cannabis, the biggest virtue of it is how easily it works for so many different conditions. The tragic flaw is that is where most patients stop. They get a very moderate improvement in their symptoms. They found something that works, they're going to stay with it. The tragedy is by paying close attention to different cannabinoids that may or may not be present in cannabis strain, the terpenes present, the timing and the routes of administration even can make a small improvement in a patient's symptoms into a tremendous improvement in the quality of their life. That's a little bit more complicated and difficult, but that's the jump I've been making with patients for a number of years now, and the information that I'm looking to provide to you today so you can start doing this yourself. Achieving the optimal results using medical cannabis can be quite complicated. I always like to relate the story of a patient of mine I met 15 or 20 years ago, I guess. A lady that had 4 or 5 different back surgeries done trying to improve her symptoms. Of course, she was not getting better and in fact got worse. Then she developed a nerve pain in her legs. It would come and go. It was episodic. When it was present, her pain was so intense that even clothing touching her skin was painful. And then she comes down with Parkinson's disease. She had been seeing another physician for a while and had been being treated and without much of an improvement in her symptoms, and that's when she sought my care for a second opinion. She was having to use a walker to ambulate with when I first met her and visibly shaking from her Parkinson's symptoms, and was a bit disillusioned with the entire medical profession at this point in time. She had used a bit of cannabis, just black market cannabis off the street, and had found that it did improve some of her symptoms, and she was interested in possibly pursuing that. At this period of time, medical cannabis was not available in the state of Arkansas, but she did have some friends out west, and I helped her as far as her choices of medical cannabis that she would use. After working with her for about 3 or 4 months, she has gone from visibly shaking from her Parkinson's disease and having to use a walker to ambulate with to walking around without a walker, and you can't tell she has Parkinson's by looking at her at this point in time. Now, don't get me wrong, she still has her pain complaints. She still has her Parkinson's disease. It's just her symptom control has improved so dramatically that the quality of her life has improved. I always like to tell patients I didn't have her just on medical marijuana at that time. I had her on 4 different preparations of cannabinoids and 3 different routes of administration to address her complaints. She was on a set of edible cannabinoids that controlled her Parkinson's fairly well, but did a half and half job on her back pain. I stacked a tincture with an additional cannabinoid on top of that, and then we had good control of her Parkinson's disease. Her back pain was doing quite well, but when this nerve pain in her legs would come on, it was very, very intense, and almost nothing seemed to take a hold of that. For that, I had her use a wax concentrate with a little electronic vaporization pen. Did not really fix her pain, but it made it bearable while she was experiencing it. And at night, she had terrible insomnia, and I still remember the name of a strain she brought back from Colorado one time called Russian Assassin. She would say she gets about 3 or 4 pulls off her pipe of Russian Assassin, and she has to get up off the couch or she's not going to make it to the bedroom. This shows how complicated it can be to cobble together the right mix of cannabinoids and routes of administration in order to turn a little bit of improvement in patients' symptoms into a tremendous improvement of the quality of their life. Achieving the optimal results using medical cannabis requires a basic understanding of how cannabis works in the human body, and that brings us to the endocannabinoid system. Right now, your body is producing cannabinoids similar to THC. They're used as neurotransmitters. Neurotransmitters are the chemical that nerves use to communicate with each other. One nerve makes the neurotransmitter and it goes across the space between the cells. On the surface of the other cell membrane is what's called a receptor. It's a large three-dimensional chemical group. One cell makes a neurotransmitter, goes across the space between the cells. When the neurotransmitter contacts the receptor, it fits in there a certain way, a very specific way called binding. When it binds to this receptor, it activates it. It causes the other nerve to do something different. It changes its behavior. This is generally how nerves communicate with each other. Now, these endocannabinoid receptors, they're present all throughout your body. Now, they vary according to which ones are where, receptor density, and these finer points, but they're present throughout your entire body. That's the take-home message, with one exception, and that is the brainstem part of your brain. There are almost no endocannabinoid receptors on the brainstem part of your brain. Now, the brainstem is part of your brain that keeps your engine running, essentially. It keeps your blood pressure where it needs to be. It keeps your heart beating, keeps your lungs moving air in and out. This is the part of the brain that a lot of medications will poison you. Everybody's heard how the opioids cause overdose deaths in people. It's because it turns off your respirations due to opioid receptors located on the brainstem. Most patients at this point in time are familiar with the fact that in all of recorded history, nobody has ever been poisoned and overdosed on cannabis. This is one of the reasons why. Now, the endocannabinoid system does not just have one function. It's what we refer to as a homeostatic mechanism. The endocannabinoid system coordinates all the other systems in your body together to keep them optimally tuned up for, well, survival of the organism. Your body's just trying to live another minute, another day. The endocannabinoid system is involved in modulating almost all the activities in the human body. It's involved in thermoregulation, glucose metabolism, lipid metabolism, inflammation, pain, appetite, movement, muscle tone, mood, you name it. The endocannabinoid system on some level has an influence on these systems. So when you consider endocannabinoid receptors are present all throughout the human body, they're involved in almost all processes that the human body undergoes. When you take something like THC from a plant, a phytocannabinoid, and you put it inside a human being, THC interacts with the endocannabinoid system. You see how you're going to affect a great many processes very easily. This is where the virtue of cannabis comes through, how easily it affects so many different processes. Phytocannabinoids, again, those are cannabinoids obtained from the plant. They interact either directly or indirectly with the endocannabinoid system. Most patients have heard of THC before. That's the psychoactive molecule, psychoactive cannabinoid in cannabis. There's other cannabinoids also. There's CBD. Most patients have heard of that. These cannabinoids may or may not be present in any particular cannabis strain we're looking at. There's other cannabinoids too. There's CBG, there's CBC, there's delta 8 and delta 9 versions of THC. There's CBN, there's THCV, CBCV. There's a lot of cannabinoids that may or may not be present in cannabis. Now, there's a whole other set of compounds we have to consider in cannabis also, and they're called terpenes. Now, terpenes are aromatic compounds. Cannabis makes them, a lot of the plants do too. I think there's between 15 and 20,000 that have been characterized in different plant species, with 1 or 200 that have been detected as being present in cannabis. Being aromatic compounds, that's not really that much of an interest, but terpenes have also been referred to as the fifth element, the life force, the spirit of essential oils. The interesting thing about terpenes is that they have physiological properties in mammals and, of course, human beings at very, very low concentrations. Terpenes are present in a lot of different types of plant products, including pinene is present in pine. There's beta-caryophyllene that's present in peppercorns. Humulene is present in hops. Again, widely present throughout nature and widely recognized as being safe in humans to consume. Now, there are many terpenes that may or may not be present in cannabis. I'm going to go over just several of them. And one of the things that I like to do in dividing terpenes up is to divide them into the so-called sativa-like effects and indica-like effects. The sativa-like effects are considered energizing, uplifting, often referred to as the headspace high that people get. These are associated with alpha-pinene and limonene primarily. All the other terpenes you may see in cannabis are more associated with the indica-like effects, the body high, the relaxation, the sedation, and a lot of the pain-relieving qualities of cannabis. As far as the sativa terpenes go, alpha-pinene is not a sedating terpene at all. It's a bronchodilator and an expectorant. It's an anti-inflammatory. It improves memory, as we mentioned. It's also a neuroprotectant. It's the terpene that can cause anxiety and panic attacks in some susceptible individuals. Limonene is another sativa-like terpene. It's not at all sedating. It does have anti-anxiety and antidepressant effects. Like most of the terpenes, it does show anti-inflammatory properties and is also an antioxidant. Interestingly, limonene has been shown to improve gastroesophageal reflux symptoms in some patients and does improve the transdermal delivery of drugs. You'll oftentimes find limonene as an additive to cannabinoid preparations that are meant to be used topically for that very purpose. The so-called indica terpenes include beta-caryophyllene, a very common one found in cannabis. Beta-caryophyllene is somewhat sedating. It is one of the few terpenes, actually the only terpene, that directly activates the cannabinoid receptor 2. That's one that's involved in inflammation primarily. So that makes this a potent anti-inflammatory terpene. It is an antioxidant, does have anti-seizure properties, antidepressant, and gastroprotective properties associated with it also. Myrcene is a very common terpene in cannabis. Myrcene is the one that a lot of people say gives them couch lock. It can be a very sedating terpene at the higher dose range. It does have anti-inflammatory properties, is an antioxidant, does show some muscle relaxant properties, at least in my patients, and does have analgesic properties where it works directly in an area of the brain. Alpha-humulene is a sedating terpene that, again, shows anti-inflammatory antioxidant properties. It's toxic to certain cancer cell lines. Linalool is a common terpene that's a very, very sedating one. It does show anti-anxiety properties, anticonvulsant properties, which can be very useful, is effective against certain types of cancer cell lines, has its own pain-relieving properties, but does have a side effect to where I'm advising my patients with supraventricular tachycardia, and you know who you are, to avoid linalool dominant strains. It is the combination of cannabinoids and terpenes present in cannabis that account for the clinical effects that we see. All of what we've been talking about brings me to what's referred to as the entourage effect. Now, Dr. Russo, he's a medical physician that has come up with the entourage effect theory as a way of applying medical cannabis to patient practice. Although it's a theory, I have worked with it for long enough with my patients to have proven to myself that, at least in my opinion, the entourage effect theory is in fact real, and it is the perspective I bring to all the advice that I give patients as far as using medical cannabis, so I feel it's important you understand a little bit about it. Dr. Russo states quite eloquently for us exactly how the entourage effect works. He states that it is the presence of and relative ratio of the cannabinoids and terpenes present in any particular specimen of cannabis we're looking at in front of us that determine the kind of effects it's going to have in a human being, the kind of medication it is going to be. Now, this just seemed like a very logical way to approach things. I applied it in my practice, and again, I've proven to myself that the entourage effect is really based in fact. Some basic things to remember about the entourage effect is that the combination of THC and CBD is usually much more effective than either one alone. That the cannabinoids and terpenes interact together to produce the desired effects. You must always remember the combination of the different cannabinoids and terpenes is always much more effective than the sum of the individual components. This, of course, means that lab analysis of cannabis strains is required to make the best treatment choices. A little tip of my hat here to Natural State Medicinals, who has agreed to provide full cannabinoid and terpene profiles for all their strains in the interests of furthering the progress of medical cannabis patients in our state. And the other thing about the entourage effect, to always remember that whole plant extracts are preferred. Although we are talking about specific cannabinoids and terpenes, it's always good to remember that there are probably another 100 compounds within the actual plant that we haven't identified that may be contributing to the beneficial effects patients are experiencing using medical cannabis. By paying close attention to the cannabinoid and terpene profiles present in medical cannabis, and using our knowledge of the entourage effect and applying this to the patient's underlying conditions, you can turn a little bit of improvement in patients' pain symptoms that they may have experienced using any cannabis into a much more marked improvement in their symptoms using medically directed cannabis. This is a jump I've been making patients for some time now, and it is the jump I'd like my patients that I'm seeing in consultation like this for once a year to be able to do on their own. Now we're going to speak a little bit about the individual cannabinoids, and we're going to restrict it to just several of them. The first one, of course, should be tetrahydrocannabinol, also known as THC. Now, THC is an important cannabinoid component for most of you. It is a cannabinoid responsible for the euphoric effects of cannabis. THC can be effective in treating nausea, poor appetite, pain, inflammation, anxiety, depression. THC has anti-cancer and sedative properties in the higher dose ranges. THC can be used by inhalation route of administration as flower, vape cartridges, or it can be consumed orally as edibles or as tinctures. Tinctures are a lot longer lasting than inhaled cannabinoids, and they have a more reliable absorption characteristic than edibles do. They're usually a cost-effective method of administering THC when you're looking for longer lived effects. As we learned with the entourage effect, whole plant extracts for THC tinctures are preferred for the terpenes and the minor cannabinoids that may be present. Cannabidiol, also known as CBD, that's an important cannabinoid component of most patients' medical cannabis treatment plans. CBD is not euphoric. It does not make patients feel high as THC does. CBD is very important as it has anti-inflammatory, antidepressant, anti-anxiety. It's got pain-relieving qualities, anti-seizure qualities. It has anti-cancer properties and is an antioxidant, as well as having sedation properties associated with it. One of the neat things about CBD is that it actually moderates some of the side effects of THC, mostly the euphoric effects. It does this by blocking the receptor that THC works on. CBD has a low affinity for this receptor, as the scientists tell me, so it gets in the way and it blocks it a little bit. The other thing that CBD does, it's what's referred to as a negative allosteric modifier of CBR1. What that means is it changes the shape of the receptor that THC works at slightly, so that THC either does not fit in there quite the way it normally does, or perhaps fits in there differently. The end result for the patient is different nerve signaling, and overall patients feel more relaxed and calm, but not the edgy, euphoric kind of high feeling that THC will produce. CBD can be an antidote for anybody that experiences the toxic effects of THC as far as feeling too high. CBD can be used as inhalation as a balanced flower strain. It can be combined with a THC dominant flower to achieve the balanced CBD to THC ratio we're trying to achieve. It can be used as a vape cartridge, and of course can be used as edibles or tinctures. Just as with THC, the tinctures are longer lasting than the inhaled cannabinoids and are more reliably absorbed than edibles are, and are usually a cost-effective method for administration when we're looking for long-acting results. And typically the things that we're looking to treat CBD with, we are looking for long-acting results. As always, whole plant extracts are preferred. Very oftentimes the commercially available tinctures will be referred to as full spectrum when they're whole plant extracts. And this is to, again, pick up the terpenes and some of the minor cannabinoids that may be present. One thing I always caution patients about is that at this point in time, labeling of CBD tinctures and products is unregulated by the FDA or anyone else. There are many products being sold out there as CBD that are essentially bunk products that don't contain much of any CBD at all. So it is important to carefully vet your source of CBD tinctures if you're choosing to use this as part of your regimen. For patients that will be using CBD tinctures for a baseline control of symptoms, one of the things that we need to consider is leveraging the entourage effect to get the benefits that THC provides when combined with the other cannabinoids and terpenes. A technique that can be used to leverage the entourage effect using inhaled cannabis, as very oftentimes it doesn't really require a very large THC dose to get the benefits of the entourage effect, is to use inhaled cannabis containing THC around the CBD dose. If we look at the pharmacokinetics, which is the absorption and distribution of drugs within the human body, if we look at cannabinoid tinctures, they're absorbed relatively quickly, starting to have a peak blood level within 15 or 20 minutes of administration typically, and it fades out slowly over time, taking out to 2 hours in some individuals to be completely clear from the bloodstream. As anybody that's used inhaled cannabis knows, the lungs are very efficient at moving drugs into the bloodstream. Usually the effects of inhaled THC are felt within a few minutes of administration and fade out after roughly 45 minutes an hour. If you look at blood levels of THC, they follow a very similar pattern like this. So by administering a dose of inhaled THC, whether it's flower, vape, cartridge, concentrate, at the same time as tincture dose administration of the CBD tincture, and then 45 to 60 minutes later, we ensure that there will be THC circulating around in the bloodstream at the same time CBD, the other cannabinoids that may be present in the tincture, as well as the additional terpenes, are being absorbed. This leverages the entourage effect. When I've done this in my patients, used them as their own controls in a little casual study I did, almost all of them saw a marked improvement of their symptoms, oftentimes using just relatively low doses of THC compared to what they would use to take care of their pain symptoms normally. I always tell patients when using this particular method to leverage the entourage effect, you don't have to get high when using the inhaled component of this, just have to get some THC in your system. For cannabis patients who prefer to use flower as their primary route of administration, most of you will need a CBD component with it, and at this point I point most patients towards balanced cannabinoid profile strains. Some strains that have 2-to-1 CBD to THC ratios, 1-to-1 CBD to THC ratios, and so forth. However, there aren't a whole lot of balanced strains available, at least in the state of Arkansas at this point in time, and you never know when these strains may or may not be available. So as such, in order to make up for the missing CBD, mixing THC dominant flower picked on the basis of the most appropriate terpene profile mixed in a appropriate ratio with CBD flower can approximate the CBD to THC ratio that we're looking for. This is easy enough to do by determining the mix based on the desired ratio and the reported CBD and THC percentages in the flower that you are looking at. For example, a 1-to-1 CBD to THC ratio is desired. If we look at Black Cherry OG, it shows 19% THC present. Hawaiian Haze is a strain of CBD flower currently available in the state, and it shows an 18% CBD combination. A gram for gram mix of Hawaiian Haze with the Black Cherry OG gives us about the desired 1-to-1 CBD to THC ratio and should address patients that require this symptoms much better than the THC flower alone would. The last cannabinoid I'd like to discuss with you is cannabigerol, also known as CBG. Now, CBG is often referred to as a minor cannabinoid because it's either absent from or present in very low quantities in most cannabis strains. CBG, though, has major effects in the human body. CBG is the first cannabinoid synthesized by cannabis in the synthesis process. It's the cannabinoid from which all other cannabinoids are derived. The cannabinoids derived are acted on by genetically determined enzymes within cannabis to convert the CBG into the other cannabinoids. Certain strains, however, are genetically deficient in these enzymes, and they produce only CBG, providing a sufficiently high source of CBG for patients to have access to. CBG is important because it is a very, very potent anti-inflammatory cannabinoid. It also has anti-anxiety, anti-tumor, and mood stabilization properties. I usually recommend CBG as an additional cannabinoid for patients with neuroinflammatory conditions such as multiple sclerosis, Parkinson's disease, and ALS, for patients with autoimmune inflammatory conditions such as rheumatoid arthritis, psoriatic arthritis, inflammatory bowel diseases like irritable bowel syndrome, ulcerative colitis, and Crohn's disease, and other inflammatory conditions such as arthritis and peripheral neuropathy. Some of my PTSD patients and bipolar patients have also reported how well the addition of CBG is working at controlling their anxiety symptoms, and my bipolar patients have described mood stabilization properties to it when it's combined with CBD. For patients, flower mixes in an approximately 1:1:1 CBD to THC to CBG ratio. That's a good starting point. Modifications to these ratios should be based on the response. For commercially available tinctures or people doing do-it-yourself tinctures at home out of flower, the usual tincture dosing is to start at around 5 milligrams of CBG twice a day. At the same time, CBD and THC is administered, whether it be in tincture form or as an inhaled version of it. Most patients treating lower level inflammation, anxiety, bipolar symptoms respond to around 10 milligrams a day. Higher doses may be required for patients with more severe inflammatory conditions. I have seen in some of my patients getting above the 20 milligram a day threshold that nausea can be a side effect of CBG, so something to be cognizant of if you are increasing your dosing. As far as routes of administration go, I know I've mentioned the inhalation route of administration. It's very fast acting, relatively short duration compared to tinctures, which are still pretty fast acting, a little bit longer in duration, and edibles, which it's really a crapshoot as to when they're going to set up or how long they're going to last. A couple other ways that people use cannabis. I do want to mention vape cartridges for a moment here. I want to reassure people that vape cartridges seem safe as long as you purchase them from a dispensary. The vaping crisis of the last year or two, that was all associated with black market THC cartridges due to an adulterant that the clandestine drug laboratories were adding to it. Vape cartridges have a benefit of being very, very discreet. I've seen people even use them in public. They're discreet enough to get away with that. For most patients, you can always step around a corner into a bathroom to dose with a vape cartridge when you need to. Dosing with flower is not always legal where you may be or socially appropriate. So vape cartridges offer a stealthy way to use your medications when you need to. One of the things that I point patients towards as far as vape cartridges go are cartridges that have a balance of CBD and THC present. Some of the cultivators produce one referred to as a 1:1 cartridge. That means it is half CBD and half THC. The advantages of using THC and CBD together, of course, are the CBD decreases the euphoric effects of THC. It will also have a tendency to really help people calm down and relax. It's the go-to for patients that are having anxiety or panic attack issues. It also tends to be much more tolerated by people that have jobs to where they have to interact with the public and discuss things with clients that do not want to feel or appear at all impaired. It's very, very useful for stealth use like this and for breakthrough symptoms that aren't adequately controlled by baseline cannabinoid treatment. And to speak directly about edibles. Now, edibles do have an advantage of being much, much more potent and longer lasting than inhaled cannabis or tinctures. This is because the cannabinoids are metabolized to different forms of the cannabinoids in the liver. These are released into the bloodstream. They account for the more longer-lived and potent effects. However, orally administered cannabis does have a big issue with it, and that is the variable absorption, which results in unreliable onset of activity. The intensity is highly variable. The duration of the effects are highly variable. This makes dosing very, very complicated. It can be very useful as a baseline treatment for patients with constant symptoms. It does require a very careful titration to minimize the side effects that can occur with edible cannabis. And it's really not recommended as initial route of administration for cannabis-naive patients because it's very easy for them to overtreat themselves or be overserved and have the side effects of cannabis really overwhelm any of the benefits, and very oftentimes can scare these patients away from a potentially very useful medication, cannabis, because of the side effects that do occur. Now, medical cannabis can be a very, very safe and effective medication for most patients, but just as with any other medication, it's not without its risks. I'd like to talk about some of the very specific risks of medical cannabis and then mention a few general ones. The first one is that patients under the age of 18 really should not use THC unless directed by their physician. The brain undergoes a lot of remodeling during adolescence and childhood. Different brain connections are pruned and new ones are established. Now, THC, being a very potent anti-inflammatory in the central nervous system, does affect some of the cells that are involved in this pruning and remodeling process. THC may interfere with this to the extent that it could screw up brain development in adolescents and children. So unless there's a very strong reason and unless directed by the physician, we recommend that no one under the age of 18 use any THC at all. Patients with a history of supraventricular tachycardia, again, you know who you are, they should avoid strains that are high in linalool, strains with linalool as being a dominant terpene. This has a propensity to exacerbate the supraventricular tachycardia arrhythmias in these patients. So at this point in time, I'm recommending most patients with SVT avoid linalool as dominant terpene in these strains that they're using. Now, this is a bit rare, but we have seen a case of this in my practice on patients with a history of ischemic stroke. Patients with such a history, you're really advised to be cautious against using high-dose THC. Particularly when it's administered without any CBD. It can cause constriction of blood vessels in the brain, resulting in a bit of an ischemic stroke. For these patients, again, I do not really recommend the oral route of administration since it's quite easy to get a much higher dose. It's going to last a lot longer than you're anticipating. And I usually recommend CBD to THC ratios of 1:1 or greater in these patients. For patients with post-traumatic stress disorder or patients with severe anxiety or suffering from panic attacks, these are the patients that should avoid cannabis strains that are dominant in pinene. Pinene, as I mentioned several times, can precipitate anxiety in patients with these symptoms. Now, as far as getting to more general cautions, I'm going to speak a moment about cannabis use disorder. I think at one time it was referred to as psychological addiction. Cannabis use disorder is defined as the continued use of cannabis despite clinically significant impairment occurring. The easiest way to think about this is if cannabis use is interfering with your finances, with your employment perhaps, with personal relationships you're having, or you're having legal issues, and you try to stop using it and can't. That's the key thing with cannabis use disorder. You may have cannabis use disorder. Certain patients are at a higher risk of it than others. If you are in this group, I'll discuss it with you individually. But if this does occur and you think you may have this, seek a psychiatric consultation. They can help you deal with it and learn proper coping skills to moderate your cannabis use disorder issues. The last thing I'm going to mention here is cannabis hyperemesis syndrome. Now, this is a rare syndrome that occurs. It has been reported in the literature. I truly have not seen a patient with it yet. Typically, we recommend THC, particularly the Delta H variant of it, to treat nausea in patients because it's very, very effective for that. For some reason, in patients with cannabis hyperemesis syndrome, and this can occur in our patients who've been using cannabis daily for decades, they pick it up one day and it causes horrible nausea and almost projectile vomiting in them. The symptoms are relieved, strangely enough, by hot water running over the skin. Patients have scalded themselves keeping an arm underneath a hot water tap in order to stop their nausea. So, if you do find yourself getting nauseated every time you use cannabis, and the only thing that helps is standing in a hot shower, you more than likely have cannabis hyperemesis syndrome. If you discontinue your use of THC, it will resolve itself. The last thing I want to point out to everybody, though, is that medical cannabis should be used in addition to, not as a substitute for, any prescribed medications unless you're directed to by your physician. This is particularly true for glaucoma medications. I know glaucoma is a qualifying condition in the state of Arkansas. Cannabis, although THC can decrease intraocular pressures in glaucoma patients, it is nowhere near as effective as the proven drugs that glaucoma patients are prescribed, and under no circumstances should those patients discontinue their use of those medications. The same goes for the antidepressants, antipsychotics, and other psych medications that are prescribed as a scheduled dose. Abrupt discontinuation of these medications can lead to severe problems in patients. So again, don't discontinue any of your other medications without first discussing them with your physician. I'd like to speak briefly about the recommendations for the use of medical cannabis for you as a specific individual. As has probably become apparent by this point in time, individualization of the CBD to THC ratio, the preferred terpene profiles, routes of administration, dose of cannabis, and the dosing interval is critical in obtaining the optimal results from medical cannabis. At the conclusion of our interview, you will be provided with an individualized recommendation for using medical cannabis. This is all based on my interpretation of the medical literature and, even more importantly, my experience in practicing cannabis medicine with patients. These suggestions are provided as my opinion of the best medical advice as of that time. Now, medicine is constantly evolving, and recommendations, particularly with regard to cannabis medicine, may change over time. I encourage patients to be very realistic in your expectations as to what medical cannabis can do for you. Although most patients that use medical cannabis do see a degree of improvement in their symptoms being treated, some patients do not. Medical cannabis will not totally remove the symptoms, but can help improve them a bit and improve the quality of life of the patient. A technique that I encourage all my patients to do is journaling. By journaling of your symptoms, the improvements that are seen with treatment, side effects that occur, and other things that occur in your life, it's a very, very powerful tool for patients to determine the optimal use of cannabinoids, the terpenes, the dosing intervals, and it'll also bring to light various underlying activities or stressors that may be contributing to the patient's symptoms. Keeping a detailed journal is highly encouraged for all my patients. And the last point I want to make is to make the most you can out of medical cannabis. Don't be like too many patients get easily seduced by cannabis's easy virtue of providing some degree of improvement without much effort. Motivated and educated patients do far better than my patients that just continue to smoke a little weed like they have been doing for decades. Be an active participant in your medical care using cannabis. Not only will you do a lot better, it's going to empower you. You're going to be taking control of things for a change instead of just dealing with things as best you can. Learn about this ancient medication. Apply your newfound knowledge to your own unique requirements. More information about medical cannabis is available at my website at cannabisexpertmd.com. I also encourage you to follow me on Facebook, Instagram, YouTube, and Twitter under Cannabis Expert MD, all one word. I look forward to meeting with you personally and helping you get the best possible results you can from medical cannabis.